Up. Yeah, man. Yes, I could run a big topic in the morning. Yeah, I could play some things. See, I have the video them still, but I gotta just play the audio, right? Because a lady asked me, she said, "Make we have a little discussion about what you say." She asked me, she near Kate M. Yeah, she said, "Let's have a conversation, Mr. L. Are you saying that woman vagina tuni smell bad?" No, we're not talking about the smell bad or not like this, Kate. You must take out of context neither, right? But we are talking about, we have a lot of STDs and all kind of things enough people don't know about. Because, the funniest thing is, you have some people when them talk, them tell us, say, yeah man, vagina cleaner than mouth and this and that and that. But me study a lot of things. See? And me study so much things but enough people overlook. You have so much STDs and things where it don't carry even signs. But then spread it orally and all kind of things, you see? They spread it sexually, orally and everything, And it's sure, so something rise. Wait, remember, you have people with sexual partner, but them have condom for use. I don't know about mouth, no, oral and all kind of things where some people, they have multiple sexual partners. And you have enough things will lead up back to enough things. So I can just answer you, but maybe just play with the professional them I say first, and then I answer. I have the videos, but me play it and then I can just answer to that. You understand? Because if we make sure know about the body and know the kind of them kind of thing you will run across the body if you know about it. You understand? All right.
Sexually transmitted infections. Sexually transmitted infections, or STIs, have different classifications according to the Center of Disease Control. Infections characterized by vaginal discharge include vulvovaginal candidiasis, trichomoniasis, and bacterial vaginosis. Infections characterized by cervicitis or cervical swelling include chlamydia and gonorrhea. Infections characterized by genital ulcers or open sores include genital herpes and syphilis, pelvic inflammatory disease, human immunodeficiency virus or HIV, human papillomavirus, HPV. Vaccine preventable STIs include hepatitis A and hepatitis B, and ectoparasitic infections, which include pediculosis pubis and scabies. Manifestations of common STIs. Chlamydia. Chlamydia may be asymptomatic or may include vaginal discharge.
It may be asymptomatic. So it now for come with vaginal discharge. Sometimes it's included, but chlamydia. I call you about chlamydia.
Endocervicitis, inflammations of the rectum, and lining of the eye and throat can also be infected. Gonorrhea. Gonorrhea may be asymptomatic or result in painful urination, urinary frequency, vaginal discharge, pain during sexual intercourse, inflammation of the uterine lining, arthritis, pelvic inflammatory disease, and rectal infection. Genital herpes. Genital herpes causes blister-like genital lesions, along with painful urination, fever, headache, and muscle aches. Syphilis. Syphilis is a disease divided into 4 stages. During the primary stage of syphilis, an open wound or canker sore may be visible on the place of the bacterial entrance into the body. Secondary syphilis results in rash, sore throat, swollen or enlarged lymph nodes, and flu-like symptoms. After the secondary stage, syphilis enters a latent stage, in which no symptoms are experienced.
No symptom experience, because you're in a later state. So just listen good. I want to learn. I don't want somebody tell me this and that. No, me like study about things. Just listen.
And the person is no longer contagious. After a latent period, a tertiary period of syphilis begins. The tertiary stage of syphilis can result in tumors of the skin, bones, and liver, along with central nervous system symptoms, cardiovascular symptoms, and other symptoms which are usually not reversible. Trichomoniasis. Trichomoniasis may be asymptomatic, or it could include painful urination, urinary frequency, vaginal discharge, pain during intercourse, and irritation of the genital area. Genital warts. Genital warts can result in wart-like lesions that are soft, moist, or flesh-colored and appear on the vulva and cervix inside and surrounding the vagina and anus. These may sometimes appear as cauliflower-like clusters and can be either raised or flat, small or large. Vaginitis. There are three common causes of vaginitis. One is the fungus Candida. The second is Trichomonas, which is a protozoan. The third is Gardnerella, which is a bacterium. Preventing vaginitis. Avoid douching to prevent altering the vaginal environment. Use condoms to avoid spreading the organism. Avoid.
So just listen good enough. Just listen what me I say. And you say use condom. When a man, like having sex and them could have use condom. Now we talk about oral now. Where the condom, where it can protect you. I don't know. But a man feel him one thing, but nobody not tell me say, Because, alright, let's go and play it.
Tights, nylon underwear, and tight clothing. Always wipe front to back after using the toilet.
Always wipe front to back. So it's delicate because if you wipe from back to front, you mess up yourself and sick yourself same way. You so much thing, just listen.
Avoid powders, bubble baths, and perfumed vaginal sprays. Wear clean cotton underwear. Change out of wet bathing suits as soon as possible. Become familiar with the signs and symptoms of vaginitis and choose to lead a healthy lifestyle. Chlamydia is the most common bacterial STI in the United States. The majority of people with chlamydia are asymptomatic. The cause of chlamydia is Chlamydia trachomatis. Chlamydia is treatable and curable. Antibiotics like doxycycline and azithromycin are antibiotics that can kill this bacteria. Risk factors for getting chlamydia include having multiple sex partners and unprotected sex.
Unprotected sex and having multiple sex partner with chlamydia. So a man at the oral now, or you know much pardon that woman you have. And sperm step, by the way, 3 to 5 days for that. She just go to a man and think, a man that you deal with and a man. We don't know. You see, it's a complicated thing. You leave a man for film life where you want to live. But me just a play and make you know this. Because most people now have no time for this. Them just say, doctor say, this is everything with the specialist, them say.
Manifestations of chlamydia include vaginal discharge, urethritis, bartholinitis, endometritis, salpingitis, and dysfunctional uterine bleeding. Gonorrhea. Gonorrhea is the second most commonly reported STI in the United States. It is highly contagious and is caused by aerobic gram-negative intracellular diplococcus. This bacteria gains access to the body through the endocervix and is almost exclusively transmitted via sexual activity. Gonorrhea is treatable and curable using antibiotics. Risk factors that increase.
By the way, people gonorrhea in them throat. I can't look it up. I'll show you some picture later. The whole of them things, them have it in them throat too. Not them mouth too.
The risks of getting gonorrhea include low socioeconomic status, urban living, single status, inconsistent use of barrier contraceptives, having an age under 20 years, and multiple sex partners. The manifestation of gonorrhea is usually asymptomatic, but may include abnormal vaginal discharge, dysuria, cervicitis, abnormal vaginal bleeding, and Bartholin's abscess, along with pelvic inflammatory disease. Genital herpes. Genital herpes is a recurrent, lifelong viral infection. It's transmitted via contact with mucous membranes or breaks in the skin with visible or non-visible lesions. Genital herpes can be passed on from one person to another through kissing, sexual contact, or vaginal delivery. There is no cure for genital herpes, but antiretroviral therapy can be used to reduce or suppress symptoms, shedding, and recurrent episodes. The primary episode or outbreak of genital herpes is usually the most severe and prolonged. It can include multiple painful vesicular lesions, genital discharge, superinfection with candida, fever, chills, malaise or tiredness, dysuria or painful urination, headache, general irritation, pelvic region tenderness, and swelling of lymph nodes. Recurrent infections are usually more localized and resolve more quickly. One with a recurrent infection might experience tingling, itching, pain, and unilateral genital lesions that are more localized. Genital herpes is diagnosed using a viral culture of fluid from the vesicle. Syphilis. Syphilis is a curable bacterial infection caused by a spirochete called Treponema pallidum. Syphilis is a serious systemic disease, but can be treated or cured using benzathine penicillin or doxycycline if allergic to penicillin. After taking antibiotics, a patient should be reevaluated using serological testing. The primary outbreak of syphilis include canker sores and painless bilateral adenopathy. Secondary outbreaks of syphilis include flu-like symptoms, rash on the palms of the hands, the soles of the feet, or the torso, alopecia, and adenopathy. During a latent stage of syphilis infection, a person will still test positive for syphilis, but usually will be asymptomatic during this period. During the tertiary phase of syphilis infection, life-threatening heart disease and neurological disease could be experienced.
Heart and neurological disease can be experienced. It can get heart disease and all kind of things, another disease. So when you leave and treated all kind of things, enough people don't get treated for enough of these things. They just think it just go and them alright. You know, colorless, odorless, and you feel say you're alright, that don't make you alright. Enough of them not in the gynecologist neither. Enough people them don't do the test. Now play some things unless doctor suspects some things. So you will have something and you don't know. See?
Pelvic inflammatory disease. Pelvic inflammatory disease is the result of an ascending polymicrobial infection of the upper female reproductive tract. It is frequently due to untreated chlamydia or gonorrhea. Management of pelvic inflammatory disease symptoms include broad-spectrum antibiotics, oral fluids, bed rest, and management for pain. A woman with pelvic inflammatory disease will often experience lower abdominal tenderness, adnexal tenderness, and cervical motion tenderness. Pelvic inflammatory disease can be diagnosed using endometrial biopsy, transvaginal ultrasound, or a laparoscopic examination.
A laparoscopic examination and biopsy or the ultrasound. How much women in Jamaica now have the money to go pay for them examination? Them just be and say they clean. And even over there, even in America, when them say 80% of people have the HPV, some of them don't even know. You understand?
Human papillomavirus, or HPV, is the most common viral infection in the U.S. Human papillomavirus is also known as genital warts or condylomata. HPV can be diagnosed during pap smears or an HPV test.
So much of them do pap smear and HPV tests. They don't talk about the third world country, them, because if it's so much and so prevalent in the state and other places and all kind of things, what do you think?
Most HPV infections are asymptomatic, and some will have visible genital warts. HPV can be prevented through a vaccine. There is an increased risk of getting cervical cancer if you have HPV. Hepatitis. Hepatitis A is spread through the digestive tract. Hepatitis B is spread through saliva, blood, semen, menstrual blood, and vaginal secretions. Hepatitis A and B can be prevented with a vaccination. Hepatitis C has certain treatments available that can cure many types of hepatitis C. Scabies. Scabies can be seen as an itchy, bumpy rash on the skin. Pubic lice can be seen as itchy bumps on the skin with or without the visible presence of lice. The treatment for scabies and pubic lice is permethrin cream or Lindane shampoo. When treating the infection, it will be important to undergo a decontamination of bedding and clothing and treatment of family members and sexual partners. HIV. human immunodeficiency virus. Transmission of HIV from person to person is usually through the sharing of needles or sexual contact. AIDS is due to HIV infection. HIV can also include fetal and neonatal effects. After one contracts HIV, there is usually an acute phase that is asymptomatic, in which the viral replicates. After many years and often decades, HIV will begin to manifest itself through suppressing the immune system, resulting in opportunistic infections, ultimately leading to AIDS. Preventing STIs. The only truly safe sexual contact is abstinence. For sexually active people, education about safer sex practices can remarkably reduce the risk of getting an STI.
So education about safe sex practices. We no business. My man can live him life, but nobody not tell me say book back when them nah run through the thing and say, you see me I say? It's different. Alright? So I could play. I'll play next time. I can show you some other things too. Because me man like sit down and study some little things. So me answer now. And I like me I tell people say you have to smell bad. I know she clean. But make it, you can have a STI, you can have something there. You can have something there, see nothing at all. No odor, nothing at all. See? With different sex partners, some man have to know. And I like somebody have something there and them I use a condom then to prevent something. No, a man I use him, oral sex now and it spread enough set speed and them I tell no this, that and that and that. So much different so much different STDs and all kind of things and HTI or what have you. And some people want just tell you one thing, me not in the foolishness. Doing the foolishness. You understand?
Hi, my name is Dr. Doug Black. You've probably heard the safe sex talk before, why you should use condoms, birth control and the rest. Good news, for the next 5 minutes, I'm here to give you a crash course on everyone's favorite sex-related topic, sexually transmitted infections. A sexually transmitted infection is a sickness that is passed on from one person to another during sexual activity. There are many different types of STIs that can be passed on during oral, vaginal, or anal sex. Some can even be passed on by skin-to-skin genital contact. The short name for sexually transmitted infections is STIs. You may have heard people call it STDs or VD. All these mean the same thing. How do you know if you have an STI or if someone else has one? You don't. One thing that you
what I'm saying, you don't, then that alone will scare you. You never know. So it's not about no smell, lady. You say you want to have a conversation, not about no smell or something, yeah? You understand? So I never said about toilet this or that, no. And not about that. We had talk about proper health management, so yeah?
You always have to remember about STIs, most of the time they're invisible, meaning they often have no visible symptoms. The only safe sex is no sex.
Alright.
If you choose to be sexually active, there is such a thing as safer sex. That means using a condom if you're sexually active, and make sure you get tested for STIs regularly. It is important to treat STIs.
How much are them doing these things? You understand? No, them just see somebody and say them clean and them smell good and them alright. You must use, some people have spray. It must use neither than a powder. You must say no. You understand? So these things, cotton clothes, you forget here, there and all kind of things, easy to forget,
STIs as soon as possible and not to spread them. Many can easily be cured, but if an STI is left untreated, it may cause other complications in the body. Some types of STIs can cause infertility and even death. Now I will go into some specific information about each STI. If you would like more in-depth information, please go to the Sexuality and You website to learn more. STIs can be grouped into 3 families: parasitic, bacterial, and viral. Let's start with the parasitic ones. Parasitic infections. A parasite is a creature that lives off another being's body. Think of a parasite as a little bug that lives off a human but cannot always be seen by the naked eye. Number 1, pubic lice. Pubic lice are also called crabs because that's what they look like under a microscope.
Under a microscope.
Pubic lice live in pubic hairs around the genitals. They lay their eggs at the base of the hair. They can be itchy or cause a little inflammation, and they spread pretty easily. Secondly, scabies. Scabies are tiny mites that dig little holes below the surface of the skin where they lay their eggs. You can't see them, but they can cause itchy rashes also. Scabies and pubic lice can be treated with lotions and shampoos. Clean all bedding, towels and clothing with hot water. This also helps kill them off so they don't come back. Thirdly, trichomoniasis or trick. Trichomoniasis is a common STI. This single-celled organism can infect the urethra, the bladder, the vagina, cervix, or get under the foreskin in men. It can be transmitted through sexual activity and by sharing sex toys.
Sex
Often,
toys.
there are no symptoms.
No symptoms.
But trick can make the genitals feel itchy or irritated, and it causes a frothy discharge and pain during urination in both men and women. But trichomoniasis is easily treatable with medication. The next group of STIs are called bacterial infections. These are infections that occur when bacteria affect a part of the body. There are 3 of those in this category. 1, chlamydia. Chlamydia is one of the most common sexually transmitted infections, especially among people ages 15 to 24. It is spread through sexual activity and often does not show any signs or symptoms.
No signs or
If it does show signs or symptoms, some of the more common ones are itchy, inflamed genitals, discharge, and painful urination. Chlamydia is easily treated with antibiotics, but if left untreated, it can cause infertility in both women and men. Secondly, gonorrhea, or the clap. Gonorrhea is an infection that often is transmitted at the same time as chlamydia and shares many of the same symptoms. It's found most commonly in people aged from 15 to 29. Gonorrhea is also easily treatable with antibiotics, but if left untreated, it also can cause infertility in both women and men. Thirdly, syphilis. We don't need to say too much about this because it's pretty rare nowadays. Once considered very rare in Canada, syphilis is now on the rise. Syphilis is called the great imitator because it shows signs that other diseases show. There are 3 stages of syphilis. It starts with a small painless sore where the bacteria entered the body. This stage is easily treatable with antibiotics if caught early enough. In stage 2, a person may develop a general feeling of being unwell, or flat, smooth warts appear in the genital area. In stage 3, syphilis that has been left untreated can cause heart problems, mental issues, and even death. The last group of STIs are called viral infections. In general, viral infections involve many different parts of the body at the same time. There are 4 in this category. Firstly, the human papillomavirus, or HPV. The human papillomavirus is the most common viral infection in Canada. Approximately 75% of adults will have at least one infection in their lifetime. There are over 30 different types of HPV that are sexually transmitted through oral, anal, or vaginal sex. But it also can be spread by having skin-to-skin contact. Some types cause warts, and some can cause cancer if the HPV goes untreated for many years. It often has no signs or symptoms, and it may be difficult to spot.
So when you say ask me about nothing to do with smelling, to me study all these kind of things, I mean, know some of them I'm not gynecologists. You know, some man just get up and do some things if you wonder, you know. And woman too. You understand? But well, listen.
Vaccines are available now to prevent the most common types of HPV. Secondly, hepatitis B virus. Hep B is a vaccine preventable viral infection that causes problems with the liver. It's not to be mistaken with hepatitis A or C, which are other forms of liver disease. Hep B is easily transmitted not only through sexual activities, but by sharing items like razors, needles, and even toothbrushes. Signs and symptoms are tiredness, yellowing skin, nausea, vomiting, and a decrease in appetite. Thirdly, genital herpes. Genital herpes is caused by the herpes simplex virus. It's in the same family of viruses that cause cold sores around the mouth. Both types of herpes can infect the genital areas, causing painful sores. The virus is transmitted by sexual activities or by skin-to-skin contact. Most often, people mistake genital herpes for HPV or genital warts. There is no cure for herpes,
none,
but effective treatments for recurring
and someone have herpes, not them cure. No, none.
Outbreaks do exist. The virus can go into a dormant stage and display no symptoms,
none,
but it is still transmittable during this stage.
Yeah, though, show no symptoms, but still transmittable. So you think, okay, clean. When I say clean, like beard and, oh, me not spend nasty, so you can't say me nasty and this clean and think too much viral and thing run down there and run all. But we are talking about, man.
Fourthly, human immunodeficiency virus, or HIV. The human immunodeficiency virus attacks the body's immune system, leaving infected individuals unable to fight off other illnesses. It is transmitted through sexual activities, but also can be spread by sharing items such as razors, needles, and toothbrushes. It's not spread by hugging, shaking hands, or other casual contact. At first, someone who is infected might experience flu-like symptoms, a sore throat, joint and muscle pain, skin rash, and rapid weight loss. Eventually, infected individuals may get very ill and die from other infections or cancers. If you notice any symptoms of STIs and you had an unprotected encounter with someone, please see a health professional. If you test positive for an STI, make sure you seek treatment from your healthcare professional as soon as possible. You'll also be asked to contact all the partners that you've been sexually active with to avoid spreading any of the infections. It is important to treat sexually transmitted infections, many of them easily curable, but may cause infertility or even death if left untreated. To learn more about getting tested for sexually transmitted infections, watch My First Birth Control Visit and STI Exam.
All right, so may I try to show some people now. So the lady me just answer you, and me I say, woman, you know, was smelly and thing, not like that. And nobody take no trick. People will start study up them body where it's easy to catch all kind of things there, right? And them tell you what and what to do and everything. So me hear some people that talk about, doctor say, uno does a pass that on, man. When you hear somebody say, doctor say clean their mouth. Uno go and follow and pass on some things. You understand? Go and follow and pass on some things because you have a lot of sexual transmitted diseases. So when man start the oral sex and then like him have the condom, I don't know about that. Them that talk about them have a condom for mouth. Man a swallow, man a do all kind of things. That woman a do it too. You understand? They can't. They're showing us something, man. But play this first.
Program contains mature subject matter. Viewer discretion is advised.
New research from the Annals of Internal Medicine reveals a shocking statistic. 1 in 9 men in the U.S. are orally infected with HPV, the human papillomavirus.
1 in 9 men orally infected. Yeah, with human papillomavirus, HPV.
Now, the popularity of unprotected oral sex, they think that may be part of it. Research shows that 11 million American men are infected. Most probably don't even know it. And they found the infection.
Them not know it. Most of them don't even know. Because them now go test themselves, them just say, right, see, I mean, yeah, see, Angela, sit down, they say this, that, say that, I'm going to snap off the place. And them not know it. And them go home and them spread with them and spread to them wife, or them spread with them and spread to this, and you understand? See? I remember in this and I like him go there, so. And there's a condom where I protect himself. This now a oral thing where I go, them kids them. Whether the whole of them thing where we are talking about them STI have, and it can pass on to your kids them and pass on to your whole family member. Come on, man. Yeah? So when you ask them about smell bad and them things, then people say them clean. You can't know if you carry one of these kind of STI or what have you, unless you go do the test. And listen this now.
The rate is much higher for men who've had a significant number of heterosexual oral sex partners.
Yeah, so the oral cancers is not just in your mouth. If you ever have a sore that doesn't heal for 2 or 3 weeks, or you notice something that's red or white or black in your mouth, then obviously that's alarming. But when we say oral, as doctors, we mean this whole passageway. You are an ENT as well as
and what's unique to the head and neck, that you may have a lesion in part of that head neck system, but the pain is referred to another part of the head neck. So these type of cancers affecting the oral cavity.
So like if you can't swallow.
You can't, difficulty swallowing, change in your voice, actually ear pain, that a lesion in the throat, problems with your ears, you can't equalize your ears because you have a lesion somewhere near the eustachian tube. So, you know, any of these type of changes, a mass obviously in the neck or mouth, something that doesn't heal for a prolonged period of time like you mentioned.
As a little science lesson, viruses, the way they live and survive is they actually enter into your human cells, and that's the machinery they use to replicate. Well, in this case, HPV can get into your human cell, cause it to become cancerous, not just in the oral cavity in your throat. For women, there's cervix. And that's what's so crazy here is this virus, which, yeah, it can just cause a wart that's fairly harmless, but it can literally reprogram your cells to become cancerous anywhere that it infects your cells.
And, you know, from a practical standpoint, 80% of people will get an HPV infection in their lifetime. And it's true that a lot of HPV infections will just clear on their own, but those that persist can lead to precancers and cancers. And I think we can all agree that prevention is better than treatment. We have research that shows that the HPV vaccine does work. In fact, infection with HPV types that cause most HPV cancers and genital warts have decreased 71% in teen girls.
I wish this vaccine had been available when I was growing up, because this is the generation, ours.
But it's not as effective as you're older, correct?
Correct. And the recommendation is to get it when kids are about 11 or 12 years of age. Ideally, you want to get it before kids are sexually active because it's going to be more beneficial when they haven't been exposed.
The take-home message from what we're saying, though, is to just increase the awareness. Everybody knows about sexually transmitted diseases, but we think of it happening down there. But the oral contact is your conduit for not only HPV, but HIV and gonorrhea and syphilis and all of the STDs that come through mouth.
I mean, know your sexual partners. I mean, monogamy is best.
But I think this is a wake-up call, especially to youngsters out there. If you're going to engage in oral sex, know that there's no such thing as, quite frankly, safe oral sex, right?
Yeah.
There's really, I don't know how you can be safer, short of doing your trick of, I don't even know how you would do it, without a condom and trying to find a dental dam.
You laughing at my trick? It's a good trick.
Look, you're gonna have to show me backstage how to even do it, and I'm trying to, like you said, you got like scissors,
I want to see.
But I want to mention something. Typically, the only time we'll look for HPV is if you're 30 years of age or older and you're getting a pap smear.
Only time them look feet if you get a pap smear. In the state, them I tell you them look feet. But you have it and you know the symptom. That matter just come and gone. And them don't know. You understand? And them man nowadays, every man, you know, enough of them just want to sit down and, you know, them face. Oh, it's a seat. Okay. We don't want to do a phone business. But we have follow these kind of things and we know the kind of things we are going. Enough people don't have no time for you to study about them things. Because them just want to live for them life. Want to live it.
And then we'll determine if you have a high-risk type of HPV. Occasionally, your doctor might look to see if it's a specific number like 16 or 18, because those have a really, really strong association with cervical cancer. So you're absolutely right. We typically don't look, but in that instance, people might say, well, my doctor checked for HPV. That's the only reason why.
Good point.
And it sticks around for so long. It's not one of those things where you would say, oh, I have HPV this year. I didn't have it last year. Let me go to my husband. Like, no. It doesn't really work like that. It sticks around for a while, and people don't have symptoms
forever.
It's hard to determine when you got it. So if you get divorced, you'll probably go and meet somebody else who has a different strain of HPV.
80% of people carry an HPV virus.
So why you more than that? You see? So them tell you there is nothing safe about this thing and what have you. But you know, you just allow a man to film thing because they want to come up to a speed because You know, everything where I would put out, or some people put out, and everybody has a smartphone, and them just said this and that, and then people want to tell me, oh, doctor not said this, doctor them attack. And we are talking about sexually transmitted disease now. Yeah? And then even with somebody with sexually transmitted disease, and them use condom for protect themselves. What you use when you do oral sex? What you use? Because them say there is no safe way about it. So I answer your KTM. You understand that? Now I'm not to say smell and them things. But when I talk about smell, I talk about sexually transmitted disease. Where you color load and less everything, you know, see nothing. Some of them have no sign, but them have one or two or a couple of them, yeah. You know, different partner. And you want to go look up about sperms too. That take 3 to 5 days for dead. So sometimes a woman might go deal with a man there, so, and then come back and a man, you know, him just want to eat. You see? So where him eat, nothing to it. The whole of them man where she take up something or kind of little thing, I have multiple partners and all kind of things. See? The woman them are the same thing. You see? So when I go show you something what we are talking about. You see them thing, huh? Some of them thing, huh? Some of them things, if you look under this herpes complex, some of them in them mouth, yeah, you see oral herpes zester. You see in them mouth this there, and them thing there, you see them? You can just read on them, and you know, and you see some of them, you can't just go look them up, you know? You understand? You can't just go look them up. So I'm going to just show you, from a standpoint, you understand? So, and I like someone about them clean, who tell them can't say what they want to say. But this in a way, the sexual transmitted disease are where the doctor them a say. Like where them just want to say, cleaner than this and cleaner than that. You're easy to get sick as a woman. Shorter because of my valve. Sometimes you use toilet seat and you go get sick when you use toilet. You don't know if you wipe yourself, you get sick. Some people are douche, they must douche. It is sick, you leave things down sick you too. See? So it will tell you, they must say, oh, it have things and it clean this and that. Go watch some of them things. Woman, we have tight up clothes and, you know, no wipe themselves properly and thing, and we look them end up sick. Some chlamydia and all kind of thing that's develop. And mice, you know, dry up properly and them thing, and it's sick you. Yeah? You know, your clothes too long, that's why them tell you wear cotton underwear and no wear certain clothes and too much of them tights and for a long period of time and everything. So you end up sick. So the one of these things that will be sitting down and we have studied about long time. You understand? Them man that want to do for them things, them not have the time for think about no. Them kind of STI and all kind of thing. Them just see somebody and from them look and from your beard and put on clothes and you know smell. Okay, a clean smell that. See? Some of them people have HPV and them don't even know. Them don't know. Because them go around because them beard and them not carry no scent and them not carry no symptoms and nothing at all. What them are going to know? You understand? And that the pastor in anybody in them church when them are going with them thing anytime. So it's simple. So me now, you know, get me wrong, don't get me wrong, because I never say nothing like no, but smelly and them thing there. Because you know, you have some woman, them have some kind of thing there, and them themselves don't know. Unless them do pap smear or do something. See? And then most doctors not test for that neither. As like what you hear them say. See? Them don't know this. But sit down and study this. See, approximately 79 million Americans are currently infected with HPV. Roughly 14 million people becoming newly infected each year. See that? See that? And not just them alone, right around the world. See that? And if you look up them things that I study, man, and as woman and them things, so you see me I say 80% of sexual active people are infected with HPV at some point of their lives. But most people never know they have the virus. Never. Let me show you. See that? No joke me I make. See? So when it don't go give them a greater risk now when them do them oral, but you know, a man live up to fame thing, see that? Nah, me not like something me I drop on nobody. See? A man want to live fame life for no business about him. See? But we look on these things and you know, you understand, you have to look on the whole infection thing and the whole thing and all kind of thing. See that? So you know read it for yourself. So we now make up nothing at all. You understand? And it cause cervical cancer and cause a kind of genital wart. Some people see themselves with that and think it's okay. From what beard and we use the perfume and we alright. That make us alright, man. That make us alright. See? So if you don't see but nothing, and you have some people. Well, that's why my thing me like with the educational part of the things, and me as a man, a human rights activist, so I stand up for certain things, eh? But me like deal with the education part of the thing where, you know, we teach us things. When we sit down and we study something, we want to share it. Share it with the world same way and say, no, but this no look too healthy to me and that no healthy or that, but everybody have them choice to choose. But you from always remember about the sexual transmitted disease them. Because if it's so clean, you don't have no sexual transmitted disease. You don't have it none at all. Do you understand? I hear but the doctor them said there is no way about safe oral sex. No. But you can use condom and it can break, but you know, and a woman have a STD or a man have a STD, it can, you know, it can keep you safe away. But how you do it with oral sex? Oh. When a man then yam this and then go to him wife, kiss him wife, and you have so much different, the whole of them STI and them thing there, it can't equal to anybody at any time when they do all these things. And then you pass it on, whether hepatitis, whether gonorrhea, whether chlamydia, whether the HPV, any one of them. You understand? Even HIV. And then you just eat, you know, and it can. And then you just pass it on to your wife, or your baby mother, and then you have your kids, your own and them. Nothing can pass on to them the way there. See? You understand? So you see, you use your own toothbrush and you do your own things and you just do your things and you're nice, you know. You understand? So, you know, when a man wants to say, oh, I have some woman say, book back, me can guarantee you. Because you have enough woman, even in Jamaica, when they get pregnant, clinic then go. And them a jubilee at them place and the people them good. So certain tests them don't even get for it. Them have a gynecologist a dear thing in Jamaica. See? So, and I like them have, most of them have a gynecologist, you say a gynecologist, midwife deliver them. You say that, you know, you have a gynecologist, him come to deliver, or him come deliver. With some of the doctors there, where if anything, you have to run going to surgery, where you have to have a bag of money to do that. You understand? See, you use private facilities. See? Overseas, them sign it to a gynecologist. In a Jamaica, no, some nurse, the people them go to when them have baby. And no care what happen to them, that's why all kind of things happen to them. And then come out and feel say, okay, if I have a baby, I spend nice, I mean, I have nothing to run, me clean, and when they just so clean, they you only catch all these kind of things. That's why some people catch that and know when you look them up, they heart problem, them have other issues and all kind of things, bladder problem and all kind of things later. Because them don't know. They don't know, they don't know, say HPV is a thing where they won't say, you never know. Most of them have it and them don't know. Them might show you much percentage right across the place. Can you imagine a third world country? Because you just beard and man says, oh, she smells clean. So, okay, she forgot on a dinner plate. Come on. A woman has a man forgot on a dinner plate too. What kind of dinner plate, man? You understand? If you touch, if me, you can't say germs are phobic, but if me touch the door angle, I'll just say, I not use my hand to touch my food. No, I not do that. I not eat raw vegetable neither. It have to steam because sometimes them things they get H. pylori. Helicobacter pylori. We get, they like you have ulcer stomach, and it can't get better on them thing there. If I not say you have things right up on them things when you eat them, you know, you might say wash it and you catch something and get H. pylori. So I better you get it steam. But they tell you, say, no, you can't steam because you steam out this and that, you steam off the thing them what them use and how to it out there. So, you know what's so good? Use the steam and kill off any little thing. Don't want to catch H. pylori because most of the time people have them bad stomach there. H. pylori, you know. That's not true. You drink bright medicine and just take some Zantac or some things and it need some antibiotic and thing, you know. It must say, wait name? I will tell you the name of them thing there. But they need some like a tube antibiotic them double up there and give in a strong dose and then other things to treat it. But enough people don't know. Because enough people don't have the money for doing an endoscopy. You understand? Yeah? So them not go look down. Them not go look down in there. And enough people don't do that thing that I know. Them not check up themselves on the level there. See? Because health-wise, you know, check up yourself health-wise. So if you check up yourself health-wise and sexual transmitted disease, someone that keep away. So when some people get up, and you have some people too, that's why I don't like them for my, I don't want none of them for my page. You see, like you come and you talk out your thing now, That's why I keep my page. Some of them for just ban. It's like them want override it. Them, it's like a lady want have a conversation. Says, me and she have a conversation. Me like that. You can ask me a question and me answer it and I show you why and me show you the reason like this and that kind of things. Because maybe you never have look out pandemic thing. It not run through your head. You just want to feel joyful and feel nice. But you have to look on the dangers and everything will come with all these kind of things. See? And look on the sexual transmitted diseases where they are road. All of this, where enough people get on them, they even know. Herpes, syphilis, you know, chlamydia, all kind of things. Genital warts and all, yeast, infection, the whole of them things. The whole of them things, they, you know, and them build up, you know. And some people do things for them way, them use them perfume and that, I'm going to have some other things. So them things say, no, your face smelly. Oh, for me not smell me clean. No, you can't have any kind of STD and you don't even know. Because some of them don't even get sign. You understand? So should we know these kind of things? We just know these kind of things that we sit down and study. I bet you most people don't sit down and watch them things and study them things and ask and study how the body work. Me not even ask, we know. Because some say, oh, doctor said it's cleaner than your mouth. Easy to catch germs and all kind of bacteria and all kind of things they have there. So. All kind of things. And you don't even know. But through your beard, so my beard. So me clean. I walk clean down there and make me clean. Who tell you say you don't have a STD? A STI. You understand? You see what I say? So who tell you say you don't have something like that? See? HPV or something. Who tell you? You don't know. You never got a doctor go do the test and know. See? You understand? And you can go there today and by tomorrow somebody contaminate you and there you goes. See? You tell us say alright. And you out the road and do these things. So when we answer these things now, we not get up and say we are born somebody we are teach them. Teach we are teach. But as me say you have some people now, like them hear you talk and them that say like the policeman now it embarrassing in a uniform. You have to up, you know, all the force upstanding and have respect. You want to live your life, so live your life. You have some people come and leave the man alone. Listen. Someone, if you not come with that, don't come on my page, you're not going to get banned. Because listen, everybody have them right for talk. Not come here, so that's why Jamaica runs so, and mash up so. Because the care, if the care what happen, you always have some people that come leave. Just, if you don't like the people that comment, you just put your suggestion. If you think it's right and you support it, just say, oh, you support it. And whatever. But you know, not attack nobody. Leave this alone. Not go on like come, no look nasty ghetto style. If you go away, we come from ghetto, but we come out of ghetto. We grow out. You understand? And people have either freedom of speech. And people say something wrong. And them not tell me, them not kill nobody. Leave him alone. Then the same so we can go say, leave gunman alone. If you apply, you can apply it to all kind of things. If you say leave everybody, leave the government. If it's about government, leave them alone. Him there, you have some people for much years, and them there, boom, bam, bam. Uno make things so bad. We don't want Uno in my kind of field. That's why we not keep friend and them thing there, you know. You understand? We are talking about people who have uplift something. Uno too dark. Uno not see further than Uno and middle. We don't want Uno power thing none at all. As the soon we abandon, you know, take on off for the business. See? You understand? Because people have to have them freedom to talk what them say and what they write and what have you. If them never study about something, go study about it. We give them a chance, study about something. You may say, okay, this not right, you know, because I study about the thing. We know we study about sexual transmitted diseases. Not just no long time. So I'm coming and show now. See? So, through most of the pandemic, some youth had some of them women were involved in something, they not study nothing at all. Don't go when them feel sick, them go to a doctor. Because from as long as they not feel sick, them say them healthy, that's alright. And from them say, oh, me clean and me beard. That make them healthy enough. From them beard and them not smell. Them healthy. And them alright and them not sick. You understand? Like some of them, they don't even run through sickness, asymptomatic. But you spread it. See, and someone has spread it by for them out because them take it from one woman, carry it to the other. And then she go spread it from fear man where she has sleep with this and spread it around this and continue and multiply and spread them thing. Yeah. See? You understand? Remember, say HIV still the boat and them thing. You know. Can you imagine now? A man, how much man, him a couple laugh because you don't know how much man that woman that they take before. And then you go kiss your wife. You not put yourself in that position there. See? You can imagine a woman have HIV and she don't know. Because the symptoms are not show yet. She have herpes and she don't know. Asymptomatic or something, and him just boom 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 and have this and it has spread like wildfire. You understand? You the doctor them say they matter about cleaner than this, but yes, they have sexual transmitted disease, and you have so much of them in a so much different category, so much thing, but you catch down here. You have to be careful of. See? You so much of them are right now, through them I do them oral now, you say to transmit to mouth. See? You understand? So when them go and talk, make them go and talk, we just what we will and just know say, hey, we are keep it on a level. We keep it on a level. We leave the whole somewhere, you know. Because I like study about this, I like study about the human body, I like study about what kind of disease, I study about this, I study about that, I like sit back and just read up a lot of things about every little thing. See? That me like though. So me not like too much of the, you see like them movie and them when them call it now, them reality show, me not watch them. I watch news. I watch the documentaries and them kind of little things there, you know. You understand? So me like study a lot of things. See, them that on my level. When me like get up and me study. So we know say okay, this dangerous, you know. And you pass it on to your kids them and thing. But some people never sit down and do this yet. And them swear say them clean and them alright. Because them smell clean and them not carry no smell and leave and it's okay and it's okay if you do and doctor say what? Now the same doctor them I tell you and it'll kill people too. Because you have enough people have cervical cancer and all kind of things. You understand? So when them say leave alone, me no bother follow. You know, I mean I want them kind of people to on my thing because if you leave people alone, make them talk them thing. You talk about the government, you leave it like one time on the year, I have to go on bad because you have troll. If you don't have nothing to say, just say your part and just you can leave your comments. No problem. But leave an next man make him comment. So if a man say, okay, because maybe him naive at the thing and him don't know the thing, you understand? Him not educated about a part of thing, they kind of even look it up. See? So, him say feel where him wants, I say no, but brother, but you remember say you have sexual transmitted disease and them enough and this and that and enough people are symptomatic and them don't know. Anyway, you go study it and look it up. You can't have a dialogue, you can't have a, we can have dialogues, we can talk. But you know why nobody comes to show that tell it you must see, you for shut up. And leave a man, make him do what him do. Uno too enough. Don't do that. You understand? See? That's why we have one platform and we send out our message. If you don't want to do something, then build phone message and send it out because you have enough conspiracy theories. You understand? We are going for things that happen. When you drive by up a sliping road, and you see over there so one time, over there that full line long. People over there like dirt. I hear them say, boy, woman they shot me, woman over there too, Be a woman and be a man over there. See? It long. No. Them could have used them condom and not and what have you, but no, they may not use mouth and them tell you there is no safe way. With oral, there is no safe way. So not like, and you see some man I eat like a Kentucky and push. Can you imagine a man have him dirty finger in my drive? Them drive him carry all the while, open the door and everything. And take that finger and push down in a woman. With all them germs and bacteria. Then the germs them do and then in a vacuum. Nobody must say nothing. Up to that, him a pass and germs to she too. See? But me I say, how much man this lady, how much guy them have, how much sexual partner them have, when them man do them thing and pass down to them wife, how much all them woman, how much sexual partner them man have, when them a pass on them thing. See? So it easily run and you don't know. So it easily spread. You understand? When if you look up them thing there, yeah? Sexually transmitted disease. And then we don't respect nobody more. I think we don't respect nobody more. I want to study and that's we really, because enough thing, we want to go to a doctor because we don't feel sick, we don't feel say, okay, me clean, because me feel healthy, so me not have this and me not have that. Come on. And that this you do. And that the finding fine, Me there, keep it real, yeah? Lonesome, yeah? Cool. Up.